This is a podcast produced by Physios for ME, and if you haven't heard of us, head to our website physiosforme.com. You'll find out all about our campaigns and get access to lots of free resources about ME. Today we're going to be looking at a case study of someone with post-viral fatigue or long COVID or chronic COVID-19 following coronavirus infection in March 2020. We're recording this on the 2nd of September 2020, so about 6 months down the line. So we know this isn't about ME directly, but we believe that the pattern of symptoms, the assessment and the management approach are applicable to both circumstances. And it's an important example of what physiotherapists may be coming across right now. We're also not ashamed to admit that we are riding on the coattails of COVID to help spread our message about physiotherapy treatment for people with ME. My name is Karen and I'm a member of Physios for ME. We're really happy to have Luke Hanson with us today, who's agreed to share his story. And I'm also joined by Natalie Hilliard, who's also a member of Physios for ME, but today joins us with her clinical hat on, as she's been the treating physio for Luke. So thank you both. Before we meet our guests, I have to add this disclaimer that all the treatment programmes for anyone really should be individual, constantly monitored and evaluated. So it's important to remember that what we discuss today is relevant specifically to Luke and his individual symptoms and his own priorities. So please treat this as an example, not a one-size-fits-all guideline. So Luke, thank you so much for agreeing to talk with us. Can I just kind of ask you at the beginning why you wanted to share your story?
So I've had a very interesting 6 or 7 months now, unprecedented in my life so far, and it's been very difficult and a real challenge for me and my family. And in the last month or so, I've become a bit more confident in what's going on with my health. And once I realised that it's probably virus related and most likely COVID related, I felt really passionate about trying to share what's happened to me to help people in the similar situation, but also to say to people, don't go and get COVID because the implications can be long lasting.
Yeah. So Luke, can you take me through sort of an average week for you before you got ill, just to get a flavour of what your life was like?
Mm-hmm. Yeah, so I was fortunate enough to not need to work so much as of summer 2019. So I'd stopped working, and I'm married with 2 primary school age children. So I was looking after the household and really pursuing my passions for sport. So I've been a competitive runner in the past, and I had been injured for a while, so I was rehabbing that injury and pursuing other sporting interests. So a typical day for me would be getting the kids up and out of the house into school, and then having this wonderful 6-hour window to go and pursue sports. So I was doing some running, doing a lot of gym work, rock climbing, cycling, things like that. And then also, with it being winter, I was away skiing quite a bit. And after a day of sport, I'd be collecting kids, ferrying them to and from their sporting clubs and feeding them. And so the days were really action-packed.
Wow, okay. So quite a bit busy then, to put it mildly. So you believe you picked up the virus when you were on a trip to France. Can you tell me about those kind of early symptoms and how they were affecting you?
Yeah, so I didn't experience a real kind of acute phase of typical, well, certainly not typical, what we're being told as typical COVID symptoms at the time. So I was away for a week in France. I came back and everything became far more difficult. I felt tired all the time. When I was trying to run, my times were all down. When I was out climbing, I could do fewer routes. So everything was hard work. All my joints ached and my muscles ached. But I could still get on with life. So at that point, I was still maintaining some sort of, the same sort of levels of activity, although probably a bit slower.
Yeah. And so how did you treat those symptoms then to begin with?
Well, because I could still do stuff, I carried on, probably slowed down a little bit, dropped the odd activity if I didn't feel up to it, but nothing more than that.
Okay. So at what point then did you start to realise that there was something maybe a bit more going on?
Yeah, so kind of 2 or 3 weeks afterwards, I was struggling a lot, and thought I should go and get some blood tests. And I wasn't thinking viral at the time. So I went to the GP, had a set of blood tests, everything came back normal. And then I was away skiing again in March. Came back from that week skiing, and on the Monday, I could barely get out of bed, which was a complete change from the day before. Managed to get the kids to and from school, but slept throughout the day. During that week, things gradually got better, and by the following weekend I could ride my bike slowly. But from that point onwards, my energy levels were all over the place. Life was difficult every day, but some days were far more difficult. And then I started to experience these complete crashes in my energy levels, which felt like paralysis. So I'd be sitting in the living room and then unable to get up off the chair, or even unable to lift my arm. But the symptoms just came and went. So I kept going back to the GP. I had another round of blood tests, but nothing was obvious to the GP or to me. And like I say, because I had what we were being told as COVID-like symptoms in the acute phase, that wasn't being suggested at the time. I started to think that maybe my problems were lying more in the kind of complicated region between mind and body, and that I was almost having a mental breakdown that was manifesting as a physical breakdown. So yeah, life became more and more difficult, and I had no answers. So it was only when in June there started to be publications in the press, really, where people were saying they seem to be having these long-term COVID symptoms. And reading other people's stories, it all started to sound very similar to my own. And that's when I felt that maybe that's where I should be looking, and that post-viral fatigue was a good answer.
Yeah. So when did you kind of seek out help from Natalie? What month did you two meet?
I think at first, when I felt it was COVID related or post-viral fatigue, I thought I could help myself by reading what the best treatment practice would be. So I didn't do anything immediately, and I think it was then in July that I got in touch with Natalie, when I realised I couldn't do it on my own. Everything I tried kept failing, and I kept ending up in these situations where life was very desperate.
Yeah. Okay, so Natalie, then what was so tell me about your first assessment of Luke. What were you looking for specifically from a physio point of view?
So when I met Luke, so the first thing I wanted to find out was about his story and where he was currently at. And I remember Luke saying that he felt like he was functioning at about 40% of his normal, so i.e. pre-COVID levels, and this was on good days. I remember Luke telling me that the week before we met on Zoom, he'd crashed so badly that he couldn't move, like Luke said, for 3 or 4 hours, and he struggled the next day to actually get out of bed. And I know that prior to this, he'd been continuing with his cycling because he'd had a wave of feeling a little bit better. I think, Luke made it quite easy for me, because he was actually the one who realised that he was pushing himself through when he was feeling a little bit better and then crashing quite badly, that this cycle wasn't working for him. So Luke primarily wanted help with pacing his activities. And I think I was just there to reassure him that he was actually already on the right path. He'd figured it out himself. I was also concerned about the crashes, as I knew Luke was experiencing post-exertional malaise. And so I wanted to find a stable baseline in activity for him so that we could avoid this post-exertional malaise, because we know that long-lasting can have a negative effect on health and recovery. We also know from people with post-viral ME, pushing through at these early stages of illness can be detrimental. I also wanted to find out what his key symptoms were at this stage, and it's still very early in comparison. And so Luke said his key symptoms, was, well, the first one being fatigue. That was the most debilitating.
Mm-hmm.
Then the second worst symptom, if you like, was non-refreshing sleep and restless sleep. And then the third symptom was brain fog and cognitive issues. And I remember Luke saying he was even struggling to do primary level maths sums at that stage. So it's important for me to find out the key symptoms because they're often linked. And it also helps to prioritise treatment and management, and obviously bearing in mind that every patient has got different symptoms. So it's important to find that out. I also wanted to check in with Luke about the basics, so sleep, nutrition, hydration, his environment, his support structure, his work situation. The Royal College of Occupational Therapists and the ME Association produce great guidance on getting these things right at this early stage. And so it's really key to talk about the basics. And it's not really basics when you say basics, but it's actually not. It's quite complex when you break them down.
Yeah.
But again, you know, Luke made it easy. And I think being an athlete, and I think Luke played it down a little bit. He was an elite athlete, pretty much. So he has a very structured approach to his training schedule. And he already knew the importance of, you know, good sleep, good nutrition, good hydration. I think, though, Luke had already realised that he'd been carrying a lot of stress around nutrition whilst he was training, for which he was working through in his therapy sessions. So another key area I wanted to explore and look for was how much rest and relaxation Luke was having, and we soon realised that this was a pretty major priority for Luke in his management plan going forward.
So what did the management plan sort of look like for Luke then?
Well, the management plan really started talking about what is pacing and activity management, and the aim is to find a stable baseline for Luke to avoid this cycle he was in of overexerting and then crashing. Really finding a stable baseline meant having an activity and rest program in place that Luke could sustain over most days. Also about having flexibility within the plan, because life is flexible and unpredictable, and so also understanding that the process is a learning process. And that's a really important point for COVID, because it's a new virus. We don't fully understand it. We don't really know how it can play out. Although we can draw upon experiences with other post-viral fatigue syndrome or ME, there's still a lot unknown. So this was a learning process for Luke and for me. Luke is really aware of his body. He was becoming very aware of his limitations and the potential harm in overdoing things. So he was acutely aware of the need to reduce activity and increase rest. We talked about also breaking down some of the heavy tasks too into smaller chunks as part of the activity management. I remember Luke saying he tried to mow the lawn in one go, and it was he had a payback for that. So we just talked about breaking the task into smaller chunks, and that's just one example of activity management, and also cognitive tasks, breaking those down into smaller chunks. So yeah, we also agreed that Luke would reduce the number of days he was walking, because he was walking still every day.
Right.
So to reduce that to alternate days, and then on other days to do maybe gentle yoga or stretching. Luke had done yoga before. He knew about stretching because of his sport, and we agreed that if Luke could maintain this level of activity, as well as all the other tasks he needed to do in a day, for example, making breakfast for the kids, himself, clearing away, showering, etc. If we could maintain this without symptom exacerbation, it was only then that he might be able to consider increasing his activity. But that was, you know, he needed a good period of time of having these more stable symptoms. We both also agreed that he, you know, within this plan, Luke may also need to reduce his activity further. So depending on how he was feeling. But we needed to start somewhere, and it felt like a good place to start. We talked about the natural drive to do more. And Luke was going to stay as conscious as possible of this and resist the urge to do more. It's a natural human desire, until he had found a good level of stability in his symptoms. So a key area of management for Luke was rest and relaxation. We talked about fitting in periods of rest throughout the day. We talked about what rest is and what rest isn't. We talked about the idea of having a battery that needed recharging throughout the day. And this made sense to Luke. He was going to decide when to fit in these rest periods throughout the day, with a little bit of trial and error, starting maybe with 10 minutes or 20 minutes 4 times a day, seeing if he needed to do more or less. Luke completely understood the concept, knew what he was aiming for. So that's where we started at the early stages.
Okay, and so Luke, how was it then following this plan? Was it easy to sort of get your head around, or?
Pacing sounds very, very simple. In a perfect world, you accept that you can just cut activity level down to a minimum, find something that works, and then start building it back up. But in reality, with family life and also with your own aspirations to try and live a bit, it's very, very difficult. And so I found it hard to find a low enough base level that avoids the sort of post-exertional malaise. And also really understanding what rest is. I don't think I've ever rested in my life. I've always known that I didn't rest enough. I always knew it was detrimental to my sporting performances and things, but I don't like resting. I like to be moving. And so getting that was difficult. So initially finding a good base level of activity has been hard. And managing that around family life. Like my children, as much as I think they love me, just don't really respect, don't really understand what I need to do. And so if they decide to have an argument when I'm supposed to be having a rest, the argument still happens. And so it's hard to manage. But what I have found is that I'm succeeding much better managing on the good days now. So I'm very conscious about resting throughout the day rather than waiting till I'm tired. So on a good day now, I can get up at a normal time in the morning and go to bed at a normal time in the evening. Whereas previously, like before I started doing this, I don't remember a day that I wasn't absolutely hanging by 8 o'clock and unconscious by 8:39. Whereas now, my wife's really happy because we've got our evenings back. Once the kids have gone to bed, we can sit and have a conversation or watch some television because I'm not asleep. So that bit works well, but I'm still struggling, I think, to find a base level that stops me having bad days. And I think part of that as well is my misunderstanding of how much energy I consume mentally day to day and how much energy is consumed by stressful situations. So I thought I could just cut out the exercise and then I'd be fine. But I replaced the exercise by reading and writing, and until today the kids were still at home as well. So I think I was still finding life, still using too much energy throughout the day. So hopefully I'll be able to now find a level that works a bit better.
I think it's those cognitive tasks that probably people don't appreciate that can really use up that energy.
I mean, something I experienced. We went on holiday abroad a week or so ago, and it was an easy journey. My wife drove to the airport, so I didn't have to do that. And I found by the time I got to resort, I was absolutely exhausted, and then took the first 2 or 3 days of the holiday to recover. And then same again, I was all nice and well rested throughout my holiday. Then we travelled home, and I got very, very tired after travelling home, and then had 2 or 3 really difficult days after that. Even things like that shouldn't be underestimated.
Do you have any advice for someone struggling with some sort of similar symptoms, or anyone who might be 2 months earlier than you in this process?
Well, I'd say first of all, deal with the problem as soon as possible. I think possibly I've made things worse for myself by leaving it for so long. This won't go away unless you deal with it now. And it seems that the best way to deal with it is by letting your body rest and recover from whatever it is that's tormenting it. So the sooner you start doing that, the better. And to achieve that, you need to look at your life and cut out anything you don't need to do, and remove as much physical and mental stress as you can. I think something I certainly didn't understand was what rest means. You know, for me, rest was sitting and reading a book before, or some other cognitive exercise. Whereas I've now discovered rest. The best way to rest is to lie down in bed and close your eyes, and do nothing and get as close to sleep as you can. And that's really when your body is resting. So that's important. And then when you're planning your day and your week, build those rests in. So before I was waiting till I got tired and then resting, whereas now I'm trying to build those rests into the day, and it makes my day a lot more enjoyable and easy to live with. And it's also, I think Natalie mentioned sort of the breaking up of tasks. I think before, even when I was struggling, I'd think, I need to cut the grass today, or trim the hedge, or cook a meal, and I'd get it out of the way and then have a rest. Whereas now I'm splitting, happy to leave a job half done, and maybe cutting the lawn takes me 2 or 3 days now. Well, that's okay. It's not going anywhere. So I think that's another useful tip. And then finally, I'd say just get as much support as you can. Tell people that you're struggling. And I tried to manage it completely on my own for a long time. And then I told my wife I couldn't cope anymore and I needed her help, and that massively helped me out. And then telling my family, and now just telling people in and around the village has been really supportive. People are very understanding. People are immediately offering to help out with childcare and things like that. And again, take their help, because as soon as you're better, then you can help them in reciprocal. I would definitely have been the kind of person who say, oh, no, I'll cope, I'll be fine. Whereas now when people say, well, would you like me to pick your kids up from school today and take them home and feed them, I'm taking them up on it, because I need to get over this as soon as possible.
Yeah. Well, thank you so much for sharing the story. And I mean, your story is not complete. You're still, still kind of early days in a way. And would really like to kind of check back in with you over time to find out how you're getting on and how things are changing, if that's okay with you.
Pleasure.
Natalie, given that someone like in Luke's position is likely to show up to a private practitioner or maybe an MSK NHS service, what kind of advice would you give from a physio perspective when it comes to assessing and treating someone in a similar position to Luke?
Yeah, good question, Karen. And just before I answer, that's a really great summary that Luke gave about, how to manage this, and accepting help and support is massive. So yeah, just really important point. So in terms of, a patient turning up to a service, it obviously depends on what the patient's turning up for, what help they're asking for. So the usual physio approach, a really thorough subjective assessment as we normally would, listening to the patient's story, how COVID has affected them at the beginning and how it's affecting them now. Are symptoms the same? Are they worse? Are they getting better? That would guide our advice and support, and tell us perhaps where we need to go next. I think it's really useful to ask for a list of symptoms in order of the most challenging first. I generally ask for the top 5 symptoms. The list can be longer. And I think this helps to prioritise treatment and management. And because post-COVID symptoms are variable, multiple and complex, it just helps to build in some structure. I think also an important thing to do at this stage is to find out if further referrals are needed. So, for example, if a patient is experiencing autonomic problems, heart rate variability, blood pressure changes, or chest pain, things like that, it's important that patient is referred back to the GP and perhaps further investigations are carried out, especially if somebody is, say, self-referred to an MSK clinic, private MSK clinic, is picking up some of these things that need further investigation. And it's also important to exclude other fatiguing illnesses. And again, like Luke said, this may be that the GP needs to carry out further blood tests or further investigation. I would also say at this point that some of the symptoms that people with long COVID are experiencing can be quite unique and unusual. And I think as a physio, we have a responsibility to listen and believe the patient. We can't repeat what's happened with people with post-viral ME, particularly women who have been accused of being hysterical or anxious, and that these psychological issues are causing their symptoms. So, of course, people experiencing long COVID may have anxiety and depression. Their whole life has been flipped upside down, but we know it's not the cause of the physical symptoms. So I think that's just an important point to make. Physios need to explore the key symptoms, and if they can't help with a particular area or issue, refer to somebody that can. I think it's also really important for physios seeing post-COVID patients to brush up on their knowledge of pacing and activity management. So the ME Association website and the Royal College of Occupational Therapy website, they both have great guidance on there. And also our website has some really good information on pacing and on heart rate monitoring as an aid to pacing. And it can be a useful tool for many. And I think we've not discussed heart rate monitoring in this interview, as Luke and I felt it wasn't the right tool for him. But I am using heart rate monitoring with other post-COVID patients, and I think physios are ideally placed to use heart rate monitoring. Physios for ME have recently done a podcast on heart rate monitoring, so that should be available soon. So if you're a physio listening to this and want to find out more about heart rate monitoring, please have a listen. I think it's also important to say that if the person does need help with pacing and activity management, that there is the possibility of referring to specialist ME CFS clinics. I'm a private practitioner. I'm hearing that some clinics are taking on post-COVID patients, so it may be worth exploring that as an option. And I think it's also important to remember the wider issues for the patient. So their environment, do they have support in place, can they work, they need a referral for social services, for example. And as physios, we're in a perfect position to signpost patients to other services. They need equipment at home to reduce energy expenditure, for example, a shower chair. Does the person need to see an OT who could help with both equipment and looking at energy management? I also think it's important if someone, say, is coming into an MSK clinic for pain or weakness or shortness of breath, the programme needs to take into account the patient's energy levels. It may just be that we need to adapt our treatment approach to suit the energy level so that the person is not experiencing an increase in symptoms. And this might just be as simple as starting exercises in a supine position and then gradually building into a more upright position, but avoiding post-exertional malaise if the patient is presenting with that. And lastly, I would say that within the post-viral stage, 1 to 4 months post-COVID, we know the best advice is to rest, plan, pace, prioritise. So if we stick to these principles, we're practising safely. If we're tempted to push someone beyond their limitations, we know this could be detrimental, and we know this from patients with ME who were using graded exercise therapy in the past as a treatment approach, and some went from a mild illness to a severe illness, and some never improved from this. We know now that NICE have recommended that graded exercise therapy is not the treatment approach for post-COVID patients. So again, if we follow this guidance, we can make sure that these patients have the best chance of recovery.
Thank you so much, Matthew. Some really good advice there. And as you sort of said at the start, it's not really possible to say this is a one-size-fits-all approach, because every person is different. COVID is this unknown entity, isn't it? And like pacing, it isn't like a case of here's a schedule that everybody will follow, because as you know, you and Luke, almost it seems like you've worked as a team together to create a plan that works for Luke and his life, and that's a lot of back and forth between the two of you, it looks like, and that's kind of how it should be, shouldn't it? That relationship between a therapist and the patient, it's a two-way thing to get the best for that patient, as opposed to, I think physios sometimes we like having a I know the answer to this problem, do as I say approach, because we want to help. But in this instance, it's a much more fluid, kind of unpredictable relationship, isn't it? Well, I hope I really find it really interesting listening to you, Luke, and kind of your story and how things are going. And as I say, hopefully we can catch up with you in a few months maybe, and get a bit of an update and see, you know, are you continuing to pace at the level you're at? Has anything changed? And sort of, you know, it's a total question mark as to where you go, but would hopefully follow you along and see what happens, if that's okay. Yeah, but thank you anyway for both of your time. And as I say, if you head over to the website, which is physiosforme.com, you'll be able to get lots more information, both post-COVID and ME. So thank you. Bye.
Thank you.